Today, we will explore how real-time PCR helps us detect Salmonella typhi, the bacterium responsible for typhoid fever. Salmonella typhi is a model flagellate gram-negative bacillus. Its surface is equipped with a complex lipopolysaccharide structure, composed of the O-polysaccharide, the R-core, and lipid 8, all critical for its virulence. Importantly, Salmonella typhi can also produce the B antigen, a protected polysaccharide capsule that helps about the host immune system. The natural history of typhoid fever, according to Lieber and Clark, starts in the pre-pathogenesis period. Salmonella typhi is transmitted through the fecal-oral route, usually via contaminated food, water, or contact with chronic carriers. Risk factors: poor sanitation, unsafe water, and environmental factors like high temperatures and rainfall. Primary prevention focuses on promoting health, hygiene, and sanitation. Early diagnosis and effective treatment are critical secondary prevention strategies.
Pathogenesis and symptoms. After an incubation period of 5 to 21 days, the bacteria begins to spread throughout the lymphatic system and bloodstream, reaching various organs. Early symptoms often start subtly: headaches, general weakness, and malaise, making it difficult to diagnose at first. As the disease progresses, patients may develop abdominal pain, high fever, diarrhea, or sometimes even constipation, which can vary from case to case. In more severe stage, complications such as a persistent high fever, delirium, a slow heart rate known as bradycardia, internal bleeding, and even septicemia can occur, especially if left untreated. These symptoms highlight how crucial early diagnostics and antibiotic treatment are to prevent serious outcomes.
Virulence factors. The bicapsular antigen helps the bacteria hide from the immune system. In addition, Salmonella typhi uses quorum sensing, a method of bacterial communication to coordinate actions like biofilm formation, enhancing survival.
Real-time PCR targets the bacterial DNA, specifically genes like AMBA, essential for invading host cells; BIAB, responsible for producing the B antigen capsule; FLICD, involved in bacterial motility. Each of the genes plays a crucial role in the bacterium life cycle and pathogenicity.
The test uses a liquid sample like blood, feces, or bone marrow. DNA is extracted and amplified through quantitative PCR using fluorescent probes like TACMAN or dyes like SYBR Green. Thermocycling steps include denaturation at 95 degrees Celsius, annealing at around 60 degrees Celsius, and extension at around 72 degrees Celsius. With each cycle, the fluorescence increases, allowing real-time detection of the bacterial DNA. The test uses positive and negative controls, and often an internal control. Results interpretation is simple. A positive sample shows clear exponential amplification, and a negative sample remains flat. If results are doubtful, especially with a high cycle thresholds above 40, the test should be repeated.
The real-time PCR test for Salmonella typhi boasts over 95% sensitivity and over 98% specificity, making it primarily a confirmatory tool, though it's also helpful for outbreak screening. Advantages: it's rapid, sensitive, doesn't require bacterial culture, and can detect infections even at early stages. However, there are challenges. It's expensive, requires specialized equipment and trained personnel, and can sometimes detect DNA from dead bacteria, which may complicate interpretation.
Several companies offer real-time PCR kits for Salmonella typhi, including Bio-Rad, Thermo Fisher Scientific, QIAGEN, Applied Biosystem, and Certest Biotech. The cost per test ranges from $25 to $80, depending on the provider and testing scale. In conclusion, real-time PCR provides a fast, accurate, and safe way to diagnose typhoid fever, helping us detect infection early and prevent outbreaks.